Good morning, Dr. Morse, injury experts. Let's talk about this crazy Tank Dell injury. Now, initially we heard that when he slid and caught the ball, unfortunately running into his teammate at the same time, that he had suffered a dislocated kneecap or patella. Now, patellar dislocation would basically mean that the kneecap slides all the way over, thereby having to pretty much tear the MPFL, which is the ligament that holds underneath the kneecap, that holds it in place. But given the angle, I was way more concerned about a fracture, possibly of the distal part of the femur down here, or a complete knee dislocation, meaning at least two, usually three ligaments, sometimes all four, of the knee, usually MCL, ACL, sometimes PCL, and LCL can happen, but it's rare, where it literally tears, so the knee, instead of being like this, is now like that. Now, the issue with a knee dislocation, which is what actually it was, is that the severity of instability afterwards is incredible. This leads to usually at least one surgery, sometimes multiple surgeries. And there are blood vessels that come down the back of the leg along with the nerves that go to your ankle and foot. And when that happens, sometimes you can tear that artery or vein or damage that nerve due to the rotation and the stretching of that injury, just due to the sheer trauma to the knee. Now, he immediately went to the University of Kansas. They evaluated for this, they evaluated for fractures, and they determined, based on what we know so far, that he did not suffer an artery or nerve damage, or at least artery damage, we'll say that. How can I say that? Because he didn't undergo immediate surgery. That was the only way you're going to be able to prevent blood flow loss to the foot, which would usually mean trying to prevent the tissues from becoming necrotic and basically meaning prevent you from losing the foot. If that happened, he would have immediately underwent vascular surgery to repair or fix that blood vessel that was damaged. So the fact that he didn't have surgery yet and was released back to Houston already tells me that he did not suffer an injury to the vascular compartment that compromised his lower extremity, his foot, in this. That can happen with a knee dislocation. Thankfully, it didn't here. So what are we dealing with overall? We don't have specifics in terms of exactly what he tore. The amount of energy it takes to dislocate a knee is significant. So anything is fair game here. When you look at the photos of Dell after he stopped rotating or mid-rotation, you can see that the angle looks like either the knee is dislocated off, so instead of being nice and smooth, it's kind of like half and half, or he fractured the femur, so now you see it, instead of being square, it pops out. Now, if it popped out and it was dislocated like that, he would have had to have immediate surgery, usually. So that is part of the reason why I say that's less likely, because he didn't suffer that. Because he hasn't had surgery, he was allowed to go back to Houston. So therefore, we could say he unlikely didn't have a open fracture, meaning the bone actually popped through the skin. That's an Alex Smith situation. And he didn't likely suffer a significant unstable fracture, because that usually would have been stabilized as well. So what does that tell us? He probably suffered an isolated knee dislocation, not kneecap, true knee. This has been confirmed by Adam Schefter and the other significant NFL reporters. What does that mean for Dell? Mind you, this is the same leg that he suffered a fibula, which is this bone, last year. Did that potentially contribute to this injury? Maybe. If the player his teammate that was next to him wasn't physically there, in my opinion, this wouldn't have happened. He might have suffered a little bit of an injury, but not this. He tried to slide, and the player prevented him from fully sliding. So that energy got bottled up into that knee, causing that knee to dislocate. That's essentially what happened. So with that being said, this significant injury, this is why they went onto the field. This is why they brought him onto the ambulance immediately. This is why C.J. Stroud was visibly upset both during the thing and in the post game. That's his best friend, he stated, and he's already coming back from a significant lower extremity injury last year. So what does this injury mean? So they're likely going to do a combination of CT scan and MRI, probably even multiple if they need to determine exactly which ligaments are damaged and if there's any fractures and exactly what they need to repair and if this is a 1 or 2 stage approach. Now, to give you an idea, Nick Chubb, who suffered a significant knee injury last year, not a dislocation, but a significant injury where he tore his MCL and his ACL, he had to undergo a 2-stage repair because you have to stabilize the MCL before you can reconstruct the ACL because you need the knee to be stable. So this sometimes is a multiple level procedure, and that's usually why it takes over a year to even potentially think about returning to play. Now, there's not many NFL players that have suffered a knee dislocation, at least recently. The only one that comes to mind is Teddy Bridgewater. And yes, he did come back, but he was, in my opinion, really never the same. He didn't reach his true height because of that injury. Now, you have to remember Bridgewater is obviously a quarterback, and he was relatively mobile, but he wasn't running routes, stopping on a dime, cutting and whatnot. Dell is expected to do that, so that becomes a much harder challenge. Age obviously is on his side at 25, but still this is a very significant injury. Furthermore, there's not many NFL wide receivers that are as small as Dell, and I think this plays a role here. He's 5'8"-ish, 165. To give you reference, I'm 5'9", 180. So he's 15 pounds, almost 20 pounds less than me. And running into people that are 200, 250, 300, 350 pounds. I have several NFL players as my patients. They are large human beings. So is it possible that if Dell was larger and more muscular, that this wouldn't have happened? Yes. If Nico Collins was in the same position as Tank Dell was, I don't think Nico would have really had any injuries. He might have actually hurt the other player. But because Tank Dell is, 220, maybe a little bit more, somewhere around there, that's almost 55, 60 pounds more that he has the ability to dissipate or prevent that. So there's a couple factors here. Obviously, the player being physically there played a significant role, but I think Dell's size, unfortunately, played a role. What does this mean for Dell long term? Well, assuming he has at least 2, if not 3 ligaments torn, and assuming he didn't have any vascular injury, he probably has some injury to the meniscus, just given the severity of damage, wouldn't be surprising. This is a very, very difficult injury to come back from. 2025 is not realistic and is out of the question, in my opinion. The question is, can he come back in 2026 or later? Now, this is the second season in a row he suffered a significant injury and was not able to finish the season. I wish him the best of luck. In my opinion, it's very difficult for him to return, and this was probably a career-ending injury. I would not put it past him or anyone to try to return. It's just very, very difficult to do so, given the severity and the level of instability after that knee gets dislocated. It just never seems to be the same, unfortunately. If you like this type of content, I'm Dr. Jesse Morse, a sports medicine here in Miami, Florida, and I'd love to hear your thoughts, comments, concerns. You can reach out to me on Twitter, on Instagram. You can see our TikTok. I also run the injuryexperts.com. Love to hear your thoughts. Thank you very much. Take care.